Tim Reha here at Digital Health Live, wrapping up day one at CES. We're here with Samir Damani, who's a cardiologist and founder of MD Revolution.
That's right. Hi, happy to be here.
Did I get that all right?
You did.
So we've had a good time. We saw Samir at the Summer Summit, and a lot of stuff has changed up, but I want to ask you one big question is, what is digital health actually for the folks, in your view of the world?
So, as a physician, what's interesting is, this term digital health has become kind of a wastebasket term. Device companies are considered digital health companies. You've got app companies that are digital health companies. But when you really think about it from a standpoint of what society needs and what digital health really, why this market is emerging at all, it really stems from the issues for chronic disease that we have. I mean, chronic disease is crippling this country, and what we need is better ways to prevent disease. And if you look at the statistics, 80% of heart disease and 40% of cancers are preventable. I mean, that's the fact.
It's like 30% of the budget of all of America right now is going down the hole.
30% of the entire US GDP, which is 14 trillion, but it's 80% of the US healthcare budget, which is 1.7 trillion out of the 2.6 trillion is on preventable chronic diseases. So these tools that you have here, the heart rate monitors, the trackers, the Fitbits, the Withings blood pressure cuff, the scales, they're really about what can you do with the data once you generate it, right? And ultimately what we need more effective ways to prevent disease and get better outcomes. So what are the things that drive disease? If you look at it, it's body fat, it's visceral fat, which is fat around your organs, your heart, your liver, your stomach. All that fat that you used to thought was dormant is actually quite active. It produces inflammation and your VO2, which is considered your fitness level. I mean, these things are far more powerful than your cholesterol level in predicting disease, and these things can be altered by these tools. Yeah. But the data has not been heretofore aggregated in a fashion that coaches or healthcare professionals could use in a way to actually drive what we really need, which is outcomes. So in other words, I think digital health is about a new transformative model of preventive care.
And we're talking about at scale.
At scale, absolutely at scale. It's about population health management. If you can't manage large populations with this, then it's not effective.
So tell me about your company and how you're growing and some of the things you're bringing here, like RevUp.
Sure. So MD Revolution was founded in 2011. We opened a clinical R&D lab in 2012, early 2012. And what I did is I wanted to create an environment or a milieu where these tools could be used. And right now it's not able to be used in a traditional medical environment. And so we created a lab where we had, an IT person, a personal trainer, a receptionist, and a lot of it was focused around just teaching people how to use these devices. And then we saw that people become very engaged with their health when they're given power to control their health.
Yeah, and you got a dashboard, or like my car has 600 sensors in it, and when the oil needs to be changed, I'm alerted to it.
Well, yeah, exactly. So if your check engine light goes on, you want to know, you need to take it to the dealership. But even beyond that, it's more about, once you get to tracking, and if you have somebody coaching you on what you're tracking, the changes that you make are subtle, but over time they become very big changes. And so you see dramatic effects, and that's what we started to see. We started to see really amazing clinical outcomes with visceral fat, their VO2, their fitness levels, their body weight, and all the things that we know are important. But we realized that unless we built a software platform that aggregated all the data and allowed for us to coach people, this couldn't be done at scale. So that's what RevUp is about. That's what we're launching here at CES for the consumer.
It's all relatively new, like just tracking. I mean, we're just seeing the first wave of products from Lumo back over here to Fitbit to, I'm wearing the Shine right now, which is pretty cool. Yeah. So RevUp.
Yeah, so RevUp basically takes your data, and if you can focus on the screen right here, this is my data right here. So you can see, yesterday I didn't get too many steps here on the 6th. I just flew in, I wasn't feeling too well. Today, hopefully that number will get better. We have a point feed here, which we assign certain points. So I took 13,000 steps on 4 days ago, so I got 5 points for that. I also had exercise for 50 minutes 4 days ago, so I got 5 points for that. So we assign points to a certain activity that we know drives the outcomes we talked about.
I guess humans like points, I guess.
And then you can see I've earned 39 out of the 50 points this week that I need to earn. And we're starting to see that in our populations like Sharp, our enterprise customers, that when they reach certain point thresholds between 40 and 50 points, that they really start to change their body composition to a more favorable metabolic profile. And so we're learning about, how to use these tools. And so you can actually see there's also a health dashboard where you actually now see the trends in your weight, your body fat, blood pressure. We also are integrating with LabCore, but you can upload your labs to our model and it'll give you a simple thumbs down or thumbs up in terms of what it is. We also have integrated genetic information into this, so you can now take static genetic information and couple it with dynamic information from your mobile health devices. You also have, for example, a nutrition page, so you can actually have a meal plan, that's sent to you. And right here you can see that, normally there would be how many calories I was taking, but you see I'm not a very good logger. And so, I got a message.
Or you're at CS, you just haven't eaten lunch yet.
No, I just don't like logging stuff. So Amber, but the thing is I tend to log when I see Amber, because every time every time I go a while and I don't log, she usually gets me to log at least 1 or 2 meals, and it helps because then she gives me feedback on that. So it keeps you accountable, and then there's other features to it too. It's really interval training is one of the biggest pieces right now that we're finding to be driving clinical outcomes. So if you go back to the dashboard, you can see that right here is our fitness page. So you can actually see what my heart rate was right here. You can see that this was kind of light activity, and then it was really the last 10 minutes of my workout that I really was able to get into the higher heart rate zones, which really improve some of the parameters like fitness and reduce visceral fat and some of the things we talked about earlier. So that's really where it is. And then when you really talk about how we do the coaching, which is what really differentiates our platform.
So part of this is a consumer application, then
Yes.
you do clinical application.
Right, so the consumer application has a clinical interface.
Yeah.
So you can basically, on our end, we can basically see the data. So you can see here, anybody who's had high blood pressure or anybody that's had exercise levels less than what we think would be ideal, or for that matter, steps that we think that are less than ideal. So for example here, you can see that Ryan, and all this is HIPAA compliant, we've gotten waivers for people to show their data, but Ryan, for example, had less than 7,500 steps in a whole week. So he's either not wearing his Fitbit or
he got the new Xbox for Christmas.
Yeah, exactly. So then you can actually click on that, right? And you can see he's not wearing his Fitbit, right? And so, you can send Ryan a message, and actually you can, send a message, say, get to stepping, right? And you can actually send him a message.
So this also saves times for the doctor to have a closer relationship.
Absolutely, but it's not even about the doctor. There's going to be 90,000 physicians that we're short of by 2020. So if we're not building models that physician extenders can deliver preventive care, I think it's really not about the physician. The physicians are maestros or orchestrating this whole model, but it's really about software and people who are undergrad degrees with exercise physiology or nutrition science can come in and coach somebody on their diet, or they can coach somebody on how active or inactive they've been, or tell somebody that they need to go see a physician. That's something that you don't need to have a high-level physician coaching. So a lot of this stuff is wellness, in that we're just trying to get people to eat and exercise by using data and be more precise about the whole process.
So I guess what are you trying to get out of CES this year?
So one of the things, like anything else, when you create a new platform, we have enterprise customers, and so we have companies that want corporate wellness for their employees. But one of the things I really wanted to do was to innovate and iterate our platform at a much more rapid pace. And in order to do that, we need to get all the early adopters and innovators, people who like devices, like tracking themselves. And I felt like we wanted to, let people experience RevUp, because it's really transformed the lives of so many people and myself, and it makes your life much more efficient in the way in which you deal with your health. And so the whole idea is that, normally it's a subscription model, a monthly model, but we're giving it away for the first 6 months, or we're doing it for the first 5,000 people for about 6 months.
So where do they go to?
They go to mdrevolution.com, and you can say sign up for mdrevolution.com is sign up for RevUp, and on January 13th is when we're going live, and so you will get an email back from us on how to actually sign up. So as long as you have, you will need the devices, and so you will have to purchase the devices, but the coaching that you see here, the kind of feedback.
You get live coaching?
It's part of it, yeah, so it's live coaching, yeah, you'll get the live coaching.
You guys have been busy.
We will be even busier. That's the idea.
All right, well, you guys, such an animated person, love the progress, and love kind of hearing your story. What's next for you? We'll wrap up there.
Yeah, so we're launching the consumer version. We've got a mobile app coming out in April, May, both iOS, Android. We're also, really interested in the feedback from the consumers, actually. So we're very interested in the feedback from all of you in terms of telling us how to improve the platform. And then our enterprise customers, companies that really are looking for the new wave of wellness, really need to take a look at RevUp.
And tweet up MD Revolution, say I want it. Check out their website, MD Revolution.
Do mdrevolution.com. Check out the website. We did a full revamp of the website. There's videos on the website that explain a lot of what I talked about, and it's readily available. So check it out.
Yeah, so take care of your health. Tell a friend, and thanks for being on the show, Samir. Always good to see you at CS.
Yeah, it looks like we'll be doing this more often.
All right, cheers.